Hi everyone. Here we are at the content area of nursing models in the course Nursing Theory or Theoretic Foundations. At this point, hopefully everybody's getting an understanding of the structure of nursing theory. In the last content area, we talked about philosophies and going over Watson and Benner and Nightingale. And now we're moving into the next area, which are nursing models. Nursing models, or in other words known as grand nursing theories, are also really broad, fairly abstract, but they really do focus in a little bit more on the context of nursing action within certain parameters and the way that you problem solve within nursing using one of these frameworks. So let's get started. This is a short little discussion just to kind of overview the content area of nursing models for you, or grand theories. Here are your learning outcomes. These are also listed in Blackboard. I'm not going to read them to you. So you can certainly find them there also, but it is all about nursing models. One of the other things that we're going to be doing is looking not just at nursing models, but also at non-nursing models that guide healthcare systems. And these are generally the models that are used. These type of theoretical structures or frameworks are usually what healthcare systems or divisions of nursing use in order to ground the practice in that area. And so if it's an overall healthcare system, they don't always use a nursing model. They may use a non-nursing model. And so that's why we're kind of delving in and past nursing models also. The main focus will be on nursing models, but we'll delve a little bit into the other ones also. So what are nursing models? And this is directly out of Alligood's text. And again, I use the 2010 edition, which is a little bit old, but it is actually the one I had in front of me. So what Alligood says is that nursing models provide comprehensive views and perspectives for nursing practice. They are broad conceptual structures that provide holistic views of nursing. Models, also known as grand theories, are frameworks to guide the critical thinking for decisions to be made in the process of nursing practice. And so, again, while very broad, they narrow it down a little bit more than the philosophies as to the context of what you're looking at and how you're setting goals and framing your nursing practice. Okay, so, that was overriding there. I should have fixed that before I put this up. So what are the models for focus? And remember, I'm going to talk about this little box down here. Sorry about those little pop-ups, guys. Down here, I'm going to talk about this little box first. Remember, all I'm doing is touching on each one of these models. You are choosing one of these, and you are not expected to delve into all of these models. So I'm going to give a very, very brief overview, and you can decide which one actually you feel like is more one that you want to go in and learn more about. Of course, there are other models in your textbook that you can use, but just make sure that you're using a nursing model. You can't go backwards to the philosophies, so please do not use Benner, Watson, or Nightingale for this assignment. You have to use a nursing model or grand theory. So I would stick to the ones that you know are listed under the models in the Alligood text. I picked out 6 of these, and then I added in, we'll talk about a non-nursing model that I added in also because Centera uses it, and you're welcome to use any one of those for the discussion board. Okay, so some nursing models of focus. We're going to be talking about Johnson's behavioral systems model. We're going to be talking about Pender's health promotion model, Roy's adaptation model, Orum's self-care deficit theory. And although it says theory here, when we get into talking about her, it'll make sense why it is considered a model. Here is Betty Newman's systems model in nursing practice, and of course there's Imogene King's conceptual systems and theory of goal attainment in nursing practice. One way you can tell something is a model is if, and it's not always true, but generally speaking, the person's name is at the beginning of the model. So the person who developed it. So let's talk about Johnson's behavioral systems model first. So Dorothy Johnson model, she began developing it in the 1950s and the 1960s. And remember, this was the heyday of the development of these big grand theories in the 1950s, 60s, and 70s. And Johnson continued to refine her models through the 70s and 80s. This is a behavioral model, and she has separated into 8 subsystems. And each subsystem within her model, there are goals to be met. The drive to meet the goal of each subsystem is dependent on the individual client situation. So while the subsystems don't change between client and client, the need for care and goal setting within the subsystem changes based on the client situation. So it's a little bit of a twist on the systems theories that you may have learned about. And there's a lot of discussion about systems in all of these models. Johnson just really honed in on, and it's not necessarily psychological behavior, but she called it behaviors within the subsystems. And it will make sense to you once you read the chapter in Alligood. And actually, Alligood does a pretty good job of discussing her theory when they do the overview of the behavioral systems model. So I think she breaks it down pretty well. I also believe that on Blackboard that there is a quick link to a website that is a little bit also easily understood. The next one is Roy's adaptation model. And this was developed by Sister Clarissa Roy in 1964 and then refined again throughout the 1970s. And she developed this model actually under the tutelage of Dorothy Johnson. So this is an awesome model, and this is one that's used a whole lot and has been used in nursing practice, nursing education, nursing leadership. It is a wonderful model. It's used a lot in research, and basically what Roy says is that humans are in a constant state of adaptation. We are always seeking to come back to a place of equilibrium, and that the ability to come back to that state of equilibrium or adaptation is influenced by both internal stimuli, which is within the person themselves and can be physical, psychological, spiritual, and it's also influenced by external stimuli such as environment, family dynamics, and things like that. So really great model. Again, plays off of that model, off of the systems model that Johnson used, but really honed a little bit more into how the person adapts. And Roy says that nurses' goals are to assist the client to the most healthful adaptation process in their ability. Her model has been used extensively, I'm sorry, not just in acute care, but in long-term care facilities, in rehab facilities, but also in palliative care as we help families adapt and patients adapt in the dying process. Okay, Imogene King's conceptual system and theory of goal attainment in nursing practice. So this is also another great model. King was dynamic. The model is made up of 2 theories. One is the conceptual systems theory, the other is the goal attainment theory, and they work together to make the big model. In the first, the conceptual systems, and again, remember I said systems will keep playing over and over again in these models. So in the conceptual systems, there are personal systems which are personal to the individual patient. There are interpersonal systems, which are the people that the patient interacts with on a regular basis, small groups, one-on-one, and then the social systems, which are the larger community systems. Goal attainment is the process of nursing that she believes is human interaction, and that the goal attainment is not something necessarily that the nurse consistently sets. It is it is done through the nurse and patient working together to set and then to attain the goals. She was one of, not the first one, but she really honed in on patient-centered goal attainment, that if we were setting the goals for the patient, they may be unrealistic. And so that goals could only be attained if the patient actually bought into the goal. And one way to get them to do that is to have them help set the goals. And their goal setting is often dependent upon their conceptual systems. Their ability to attain goals are set on the conceptual systems. So what are their personal systems that may be holding them back, interpersonal or social systems? Okay, Newman's systems model in nursing practice. She actually developed this in the 1970s, and as it has evolved a bit over time. Let's not confuse, there are two Newmans. This is N-E-U-M-A-N, and her name is Betty. There is a N-E-W-M-A-N, and that is an extremely abstract model. It is, I believe, in your textbook. You can use it if you want to, but please make sure that if you're using the Newman, N-E-W-M-A-N, that you are actually talking about her and not this Newman. I think that Betty Newman's model is one of the easier ones to really understand, because it really focuses in on each subsystem within the individual a little bit more clearly, I think, than Johnson's behavioral systems theory. So what Betty Newman says is that that how parts and subparts of a system relate and interrelate for the whole of the client system. So and she has a list of what those systems are. It talks about the psychological systems and everything internally to the client, the patient, and everything externally. It is different than Johnson's behavioral systems theory because the focus is on the person's subsystems affecting the whole of the human system. So if we think of Johnson's behavioral system, what she says is there might be a deficit in one of the behavioral systems, and then we have to set a goal within that behavioral system to get the patient where they need to be. What Newman says is that the subsystems are being out of alignment or out of sync, or something is going on within them, and that it is affecting the whole system, and that in order to make the whole system healthy, each one of those subsystems may need to be realigned. Okay. And I think probably most of you in this class have heard of Dorothea Orem. She developed her self-care deficit nursing theory, began in the 1950s and kept doing revisions up and through the 1980s. It is a very well-known model. It was originally designed to help patients in environments where they were being discharged home quickly and kind of more of an outpatient setting, helping that patient develop that self-care. And as the model evolved, it really became integral to almost all areas of nursing practice. You can use her model pretty much like I said, in any nursing practice area. And so when we look at Dorothea Orem, you will see in some places that her model is considered a nursing theory, which is something that's a little less abstract. The reason why it's included in models by Alligood standards is that if you really look at Orem's model, it is made up of 3 theories. Each one of these is an independent theory of itself. So if you want to just talk about the theory of self-care deficit, you are not talking about the overall reaching model that Orem put forth. The overall model includes all 3 of these theories. So again, you can talk about just one of them, but it isn't the overreaching model. So in this assignment, please don't just go in and talk about the theory of nursing systems. If you're going to pick Orem, make sure that you at least touch on each one of these theoretical ideals within the overall framework of the model. So the theory of self-care deficit talks about the patient themselves having a deficit. The theory of self-care is how the patient develops into the ability to provide self-care, or how much self-care do they need. And the theory of nursing systems is how does the nurse get the patient to the highest level of self-care possible. And we know that depending on the patient, we may never get them back to their original level of self-care, but what within the context of the patient situation can we get them to, or to the family too, if we're talking about a patient who needs total care. And maybe we will never get them to a self-care place and they will need total care. Okay, Pender's health promotion model. This is one that's a little bit different than other nursing models, because Pender, and I think that this quote of Nola Pender's pretty wraps it up. It says, this is Pender speaking, I committed myself to the proactive stance of health promotion and disease prevention, with the conviction that it is much better to experience exuberant well-being and prevent disease than let disease happen when it is avoidable and then try to cope with it. And so her model is really one that we can use with every patient, but it certainly is one for community health. It is one for our discharge planning. It is one for our education. And she really is a big believer that in promoting health, we will absolutely decrease the amount of chronic illnesses and need for these expensive healthcare interventions that we are now seeing. So she's really quite phenomenal. Now let's talk about one that's a non-nursing model. This is called relationship-based care. This is the one that actually Norfolk General is now using. Originally, when they first went into using a model to guide the nursing department, they had used Orem. So they are no longer using Orem. They are using relationship-based care. This is a non-nursing model. It is an overall healthcare industry model, and it's based on the ideal that transforming care delivery by providing care that is patient and family centered with a focus on relationship really brings about better outcomes. And there are studies out there that are really awesome that tell us that that relationship-based care really empowers the patient. It gets them more jazzed about doing the healthy lifestyle things. You bring the family into it. They become more, and I hate this word, the compliant word, but they are able to engage in their care a little bit more. And it isn't just about relationship with the patient. It's about patients and families, self and colleagues. And so it changes that whole relationship with all of the people at the hospital, whether you're talking about the dietary staff, housekeeping, nursing, physicians, physical therapy, occupational therapy. It is really a team effort, and that we are all within the team, and we have to respect each other and value each member of the team's input. So having that, and this kind of actually goes along with Watson's philosophy, having that relationship, as hers is a relationship philosophy, right? It really does improve the overall delivery of healthcare to our patients. And the other thing that I like to see, what I like to think about this, is that it takes it away. I think almost all of these models do, but this one in particular takes away seeing that patient as a disease process and as something to do and as a task to get done, and you actually see them more holistically, and you understand that there is so much into the healthcare delivery besides just managing one little thing to make them healthy. Okay, so due for this content area is you have your discussion board. Your syllabus and the discussion board both tell you how many students maximum can respond using one of the models we discussed or another one of the models from the books. But again, remember it is under the model part of the textbook. Your assignment is that based on the model of your choice, you need to find a visual image that depicts the model and explains how the image represents concepts in the model and the impact of the model on nursing. And don't forget to put your application to practice. Make it a personal application. Don't just overall nurses, what they do. There is an example of this in Blackboard. I'm going to show it to you right now. This is the one discussion board that you actually are going to attach. You can do this in a Word document. You can do this in a PowerPoint presentation. However you want to do it is fine. And then don't forget you will have your reply post to your fellow classmate, and you must reply to a classmate who examined a different model than you did. What's also important about the image that you pick is that you're not picking an image of the model itself. So every model has a visual image that shows how pieces of the model are attached. That is not what we're looking for. I am looking for, or we are looking for, that you read about this model and in your mind's eye you actually can see a visual image that might depict the model. And again, remember to use the models listed in the content area or with an Ollie Goods textbook that says it's a model. Do not go back and use the philosophy from the previous week, okay? So let me bring up really quickly the example. This is the example in Blackboard, and I use Levine's conservation model because it isn't one that I talked about this week. So what's important is that this is the type of visual image we're looking for, finding something out there and then putting it on there, and then explaining why that image depicts the model to you. So you're going to explain the model. The one thing that is lacking in this, I believe, is the link to practice. So when you look at this example, please remember that in your rubric you have to have that independent area that you are linking to practice. Okay, so that's what we're looking for in this assignment. If you're going to use a PowerPoint, really use your speaker's notes area to write out. If you're going to use a Word document, just put the image on it and then right below it. Okay, so I think that is it. If you have any questions about this content area and the assignment, please be sure that you are talking to your course leads or your course facilitator, section facilitator. And remember that the group project based on the what nursing department or healthcare system, what model they're using to guide their practice, you should be well into that by now. So again, good luck this week in nursing theory, and looking forward to the discussion boards.